and I know that there are other Aboriginal and Torres Strait Islander people here in this conference who have really found it quite traumatic listening to the deficit language in which we're often framed, and the fact that we are often only described as vulnerable peoples who've got problems that are so big that they can only be solved by people who are existing outside of us, and that we have to suffer the indignities of sitting through some of the presentations that you've had to. But I want you students in particular to know this is your first conference. This is something that you will learn to work with. But we are precious and extraordinary and powerful and smart and capable beyond words. And I just need for you to carry that in your heart away with you when you leave here. Families are the ones who need to achieve equity by 2030. It will not be done by services. We are the ones who are responsible for our children. I actually think that we need a different discourse to underpin family violence, and that we need to include the discourse of disability to underpin that. If we have got organic cognitive impairment issues now, and we're starting to see them manifest in our communities in the way that we do, I think that what we need to do is actually fundamentally review how it is that we frame and create and describe the issues of family violence. We also have cultural and linguistic diverse communities, and our parents and people who contribute to parenting have all got sexual diversity as well. I've got a wonderful student who is looking at the contribution of gay men to the first 1,000 days of a young person's life. That for me is a really important point that I've learned. There are 2 people in every classroom who are sexually diverse. We've got a really heterogenetic way of viewing the world. Preconception is an incredibly important and potent time in the process of becoming a parent. We do not pay enough attention to this period of time. The best time to talk about pregnancy with people is when they're not. Sexual health and reproductive health options need to be fully explored and accessed. We've got the highest burden of sexually transmitted infections being held by the 15 to 19-year-old Aboriginal and Torres Strait Islander peoples, predominantly who live in rural and remote areas. If we cannot get the hyper-endemic nature of those STIs dealt with first, then we are remiss as practitioners in having discussions about what parenting looks like. There is enough reasons in the fact that they're not accessing our services around sexual and reproductive health to make us really think. And if we are part of the most violent places on earth, which is how our communities are often described, then if we also know that sexual assault and sexual violence happens, then why aren't we also making readily available access to safe terminations of pregnancy? Not all parents want to be parents. People do have the right to choose to parent when they're ready and able to. And some of us need to actually think a little bit more about how we engage with people in those regards. I've come through a whole background of sexual and reproductive health, and it's brought me to the first 1,000 days. I'm going to just talk a little bit in this presentation around the catalysing environment, some of the design principles that we've used, the model that we've come up with, how we're thinking about cultural protective factors and what works in regions, and the role of the university in this particular strategy. Of course, I'm using the holistic concepts of Aboriginal health that's come out of the community-controlled health movement. It has been the guiding light for my life and a lot of others in this room. And the most recent addition to the new National Health Plan has been extraordinary in that all health will be delivered in a racist-free health system. Who here is not racist? Who here works in a racist-free health service system? Then maybe that should be a recommendation from this conference. If we're all knowing that we don't work in a racist-free health service system, and we know about the full impact of discrimination and oppression, then we need to take some responsibility for our own engagement in the service systems of which we're a part. There are a range of impetuses for the first 1,000 days model. Firstly, as the chair of the National Aboriginal and Torres Strait Islander Dementia action group with Alzheimer's Australia, we found out that the new public health intervention in healthy ageing was in fact to do work with people in utero. That distressed me no end. In terms of a range of policy drivers and decision making that was happening by at-risk populations, one of the most profound teachers I have ever had in my life was a 15-year-old pregnant young woman in the western suburbs of Sydney who was smoking away in front of me after we'd just done this sexual health conference, but she told me about the fact that she had rights and they were all in the United Nations Declaration of the Rights of Indigenous Peoples. She was smoking, but at least she wasn't doing heroin, and she had the opportunity to have this baby because her boyfriend's car had broken a head on it, and she could give him the baby money to be able to fix up the car. She could actually, when she turned 16, she could also give the baby to her mother because her mother would not have access to FAS money anymore, so family assistance money. She could do that. She could actually get a 2-bedroom unit instead of a 1-bedroom bedsit by having a baby, and she could actually not go onto New Start. She could go straight onto supporting parents benefit. And these were a whole range of decisions that she had made because of the perverse incentives that had been manifest to her in policy systems at the time. So she was an incredibly intelligent, articulate young woman who had made these decisions to become a parent for everyone else but herself. When I was chairing the National Aboriginal and Torres Strait Islander Health Equality Council, we did learn about FASD, and we saw also then the great work that has come out of Central Australia, and Donna's going to talk a little bit more about this in a moment, about the rise in IQ percentile that allowed children with low level functioning to participate in primary school at a time when they needed to the most. It was an extraordinary revelation for me, and I've been a great supporter of their Abecedarian project ever since. We know that internationally the first 1,000 days is a nutritional intervention. It has had great impact in terms of growth stunting, but for us here in Australia there are a whole range of other issues that were having impact, including the increasing number of young women who are following our young men into prison. And so what a friend of mine, a Sissy actually, Torres Strait Islander woman, did a PhD on people's participation in prison systems and found 3 generations in there at one time, 47 members from the one family. It was pretty profound. And also I've been on the public record about this for a long time, but the casual way in which we are institutionally violent to our men is extraordinary. The way that we hold them in contempt, the way that we stereotype them as perpetrators of violence, as sexual assaulters, as pedophiles, the casual way in which we say that we're going to focus on mothers and children programs or maternal and child health and forget about men's roles in this space, and we undermine their capacity for nurturance and their leadership roles as head of households. That wouldn't happen in my family, and I don't think that we should perpetuate it through the casual ways in which we're violent. And I'm just going to leave that there. The other catalysing environment for me was in Victoria. Andrew Jacomos is the only Aboriginal Children's Commissioner in Australia, and his job is extraordinary. But he has found over 1,000 kids in care. Those numbers increased by 386 children in the course of a 12-month period. Majoritively, they are in prison. They are in out-of-home care because of male-perpetrated family violence, which is again related to drug and alcohol abuse. And in terms of those children and what their life trajectory looks like, I think we've got a great opportunity to interject in that in this first 1,000 days. Also, in the British Medical Journal, I wrote a small editorial, but it seemed to have a large impact in that what we need to do is reframe our adolescents as those who are needing health, those who are disengaged from services, to those young people who have got the roles to implement equity for the next generation. And once we start to frame our adolescents like that, then what we need to do is give them skills and opportunity to do so. We also then know that they're going to be thrust into parenthood without knowledge, skills or support. We need a new approach to health, which is particularly around a nested approach, putting children at the centre, then family and community. And to do that, we need to support drawing sectors together. Michael Marmot, some of you have mentioned him here, he talked about the ways in which we can address social disadvantage with an approach that takes in the whole of life, starting with women of childbearing age, and then working with them on the care of infants and young children proceeding through the life course. I've changed it up a little bit to say that the marginal position of Aboriginal and Torres Strait Islander peoples, change in that is not only our job, but the job of all Australians. We need the same opportunities without being made the same. We need to take an approach which strengthens culture and starts with women of childbearing age, their partners, extended family and community, and then taking that view. Now, the way I've learnt about what we think about this first 1,000 days, particularly in our communities, is that we've had 60,000 years of continuous culture. It has been severely disrupted for at least the last 200 years plus, but we've taken this multi-generational approach to the work that we're going to do. We're particularly keen in focusing on adolescence and young adulthood through to the decision-making process of becoming pregnant, and then around the birth, and then new parenthood and what that looks like, and then out to the age of 2. Most policies in Australia take into account from birth through to age 5, and we believe that there is a whole range of developmental milestones that need to be met in utero that are not catered for in a policy context. So far, we've invited and engaged over 380 people through 4 symposia focusing on scientific evidence, on research, on community empowerment and around policy. And some of the reports have come through and have had a really good opportunity to talk through a whole range of issues. And from those symposia, what we've done is design this goal which focuses on providing coordinated, comprehensive interventions, laying the foundations for the future of our families, but starting from an infant-centred-led approach. We're going to be doing a longitudinal study alongside Alliance sites. This is a new and a novel approach. We don't believe it's been done in urban populations anywhere else in Australia. This is, again, really highlighting the ideas of being Indigenous conceived and led. We're doing strong interventions. We've got about 10 that are evidence-based that we want to be able to roll out so we can test the impact of particular combinations of interventions during that first 1,000 days. We're looking from preconception through to the first year of primary school. That is how long we want to be able to do this work. What we want to know is 2 or 3 things. What is the best first 1,000 days that we can give Aboriginal and Torres Strait Islander children and families so that they can participate well in primary school? We want to know what is the best possible family formation that's going to help produce that outcome, and what are the range of service activities and interventions that actually make that level of impact. We're also going to be doing work across 3 generations, so we're taking grandparents, parents and babies. We're going to be doing baseline studies first so that what we can do is measure the impact over time. And we've also got an entrepreneurial arm to this. We're not investing in jobs. I don't believe that Aboriginal and Torres Strait Islander people want to have jobs necessarily, don't want to work in these racist-free health service systems, for example. But what people do want to do is be their own boss. And I think that business is a real opportunity in this. So we're looking to develop business opportunities as well. We're looking to take biological, familial, social and emotional wellbeing measures as well as service measures, develop a first 1,000 days workforce, so instead of interfacing with 7 different health professionals, we've got 1 workforce that caters for that first 1,000 days, and we're hell-bent on doing curriculum development. These are the combination of service strategies that we're looking to implement. There are 12 of them. It's going to be overseen by a community governance committee and validated by a scientific committee. And I have no problem with reasserting cultural authority and morality. What is happening in our families is depraved. And it was not the basis upon which we were able to provide stewardship to this continent, the ecosystems and the families who are part of that ecosystem for 60,000 plus years. And it has to be the reassertion of cultural authority and morality that brings us back to our feet rather than living on our knees. There are a whole range of different ways in which we're going to engage with our partner organisations to see these things happen. But predominantly the 4 key platforms, the legacy platforms for this work, is around the assertion of cultural authority and morality, workforce development, preconception programs and family-led decision making. We're going to be working with adolescents, men, women of reproductive age, neonates, infants and children. There'll be a range of opportunity to engage and empower these people to participate and take part in this program. We've got 3 different categories of sites as a building up to capacity to be able to recruit and initiate these first 1,000 days work. The first is to be organisational advocates. So if you're an advocate for the first 1,000 days, you need to be able to meet and demonstrate these criteria. If you want to be a champion, then you need to set those sets of criteria, and the Alliance sites will choose about 3 or 4 of them so that we can actually really get on with doing the recruitment and running the longitudinal study. In terms of what we will do in the Indigenous Health Equity Unit is to partner effectively. We'll be the academic conveners for this work. We'll create the scientific evidence, we'll design, implement and evaluate with you some of the work that needs to get done. We'll look at implementing knowledge exchange programs and evaluate your initiatives, and we'll facilitate these birth cohort studies alongside you. We've already got 15 student projects that are lined up underneath this particular piece of work. We've already got 2 Aboriginal women who are PhD students who are part of this, so we're really building up the succession planning of academics who will also come in and be able to learn how to do these longitudinal studies. And this is all based on the fact that in Megan Mitchell's recent report, she made this recommendation. It's so good, in fact, it looked like I wrote it myself, but I didn't. I promise you this. And so we're at the point now where we're waiting for funding to come through. So far, all of this design work has been unfunded. I've literally gone out, done a consulting job, brought it back in and made that money available to bring people together in order to design what this actually looks like. What we've got then is the opportunity to do these things. We've got a range of different sites that are already putting their hands up through Western Melbourne, Northern Melbourne, down at the Mornington Peninsula, out in Western New South Wales, and for some reason Wadair keeps coming up all the time. It was hilarious because some of the policy people came up and said, "Oh, Wadair, hasn't that place been done to death?" I said, "You know, right, remember when they tried to get all the kids to school and there weren't enough desks in the schoolhouse and we were all laughing?" I said, "Well, guess how old? Oh, time's done. I've got to be finished in 2 seconds." Can you imagine what they're all up to now? They're the parents of the future. And so everyone went, "Oh, maybe they're about 15 now." Yes, they are. So we need to get up there and do some work if we can. Where to from here? We're writing papers. We've got meetings now to discuss the biological sampling and genome project. We're looking to do genetic work with Misty Jenkins and Weehai in particular, where we've got 3 generations of people to be able to future-proof the project. That'll be a very exciting initiative. But also in terms of some of the ways in which we can validate the work, wouldn't it be fabulous to be able to do testing of cortisol levels in kids who've been able to do the Abecedarian project by the time they get to primary school, just to actually get some biological information as well as environmental information. We're looking to do the first 1,000 days governance and foundational members, setting up the first scientific committee. We've got student projects, like I said, we're seeking funding at the moment. We've got the short courses that have started and we're working on our prospectus. We've also had meetings with other international peoples around rolling out the first 1,000 days project. We've had delegations of the Sami people from Norway. We've actually got funding to do work with Indonesia and working with the Indonesian peoples, and then with our own peoples here in Australia. So we've got an international research collaboration of Indigenous peoples from Australia, Indonesia and Norway. I believe that the Indigenous World Conference, I was talking with Pat, the inception point was a roundtable with the Lowacha Institute, and that was an extraordinary cancer conference that was held earlier this year, but I can see in a couple of years' time we might actually have the World Indigenous First 1,000 Days Conference here, and at least this panel will be able to really participate very well. We're now at day 584 in the first 1,000 days. I can't tell you how many kids we've missed out on while I've been talking and building up a bloody banger of a storm around this. And I've heard it a number of times, but what we need is not systems reform. We don't need that, it's too difficult to reform. What we need is a systems entrepreneurial approach to policy formulation. We need to bring in a different kind of thinking because we don't want to do things better, we want to do better things. We want radical transformation, not incremental change. There are opportunities to really close this gap and a whole range of developmental outcomes. And what we want to be able to do is create peer-reviewed evidence about what works, take advantage of some of the missed opportunities to redesign our workforce and keep children in our families. This is just two last graphs and then I'll finish, but this is a very important slide. It was part of the 2016 report on how we're closing the gap. This young, beautiful Aboriginal woman who herself has just gone off on maternity leave, but she's going to be one of Australia's best epidemiologists. I can't believe how good she is, Jo Luke. She said, this is bloody wrong. And all she did was draw 2 lines on this document for me. And I'm going to show you this. And then I just was sitting there and I just did a quick mind's eye view about what was going on at the time. This is what she did. The Closing the Gap and Indigenous Disadvantage as a government initiative started about 2008, 2009, in between that time. And all she's done is draw a line over those blue dots that since that time show that in fact the gap is widening. In the period of time before that, you can't claim it. All of that was our own initiative, to be honest. You can't say we've been doing this since 1998, because during that time we had the NARS document, we had the community-controlled health sector had funding certainty, we had all the recommendations from the Deaths in Custody report, we were out there occupying our outstations, we had the Homelands movement, we had bilingual schools, we had ATSIC and regional councils, which I believe is one of the most devastating pieces of infrastructure to have lost. Actually, those regional councils really, you could go there and lobby hard for what it is that you wanted. We also had 2000, the Reconciliation Australia, where people were walking across bridges, crying, sorry, hugging people. Then we had ATSIC got abolished, it was replaced with Reconciliation. We had the 2007 Northern Territory Intervention. In the year 2010 we had changes in procurement laws, which meant that now a whole lot of not-for-profits could go for Aboriginal money, which isn't a racist-free health system actually. You should be delivering services to Aboriginal people with core money. You shouldn't be waiting for black money to service black people. I'm just saying. Anyway, I went on with that just a little bit. All of those things happened, but what you can see is the change in policy from self-determination through to us having to demonstrate competency and capacity, and all the policy shifts that have happened since that time, and the downward trend towards closing the gap has in fact plateaued. The reason why this is actually really important for all of us is that all of our kids are actually trapped in the culture of colonisation. All of us are now seriously and deeply reliant on huge multinational companies that don't pay tax in this country, that actually have more political will than we as citizens are able to demonstrate. When you think about the top 10 influential brands that people interact with on a daily basis, and those juxtaposed against the health and well-being of the oldest living culture on earth, this diversity of cultural expression which is being lost to monoculture thinking and action, the fact that we are part of the Asia-Pacific region, those technological breakthroughs, and also the increasing environmental vulnerability that plagues us all, we all have a lot to think about. Thank you very much.